may I request Anaya Rahimi, who is Pakistan's only transgender stand-up comedian, who holds a bachelor in business administrative from Comsets, Lahore, and has a diverse background in business development, project coordination, and advocacy, with experience at Gateway Insurance, Brokes in Dubai, and a lot of other private limited companies. Importantly, Anaya also is part of a community-based organization and has been, working for communities since quite a long. Thank you, Anaya, for being part of this panel. So we can actually start with Anaya. So Anaya, with your work, especially with the trans communities in Pakistan, what are the key challenges which are faced by trans individuals in accessing SRHR services in Pakistan?
Hi, good afternoon, everyone. Mainly the key challenges are compounded of social stigma and legal inequities, and also the healthcare provider biasness. What actually is happening right now is transgender people in Pakistan are not getting SRHR services as per their basic needs. There are a lot of organizations which are working for SRHR services, but mainly in HIV and STI sector. But if we talk about the hormone therapy, HRT, and the surgeries, the transition surgeries, it's not happening in Pakistan, and due to financial issues as well, because trans community in Pakistan is not financially strong to get the proper surgeries through proper channel as well. Other than that, the healthcare providers are not well trained to deal with the trans related issues, basic needs in medical care. They're not trained, and sometimes if a trans person goes to the healthcare provider for their mental issues and for the surgeries, for the HRT, there is another thing. They are related to the religious values, and it's very contradictory because they're considered as these issues are considered as mental illness or un-Islamic, because in Islam it's another thing, the Shariat code. So due to that, they are also refused for the SRHR services mostly. Yeah.
Okay. Thank you for adding that. And since now we've started talking about policy, I remember the Trans Person Protection of Right 2000, especially Pakistan. Does it help, or does it even help you as trans? Even for I can also draw so much of parallels with India, because we do have an act. But I think it pisses communities more than
It's an act. It's also an
that's
act.
still-
As an
it's
act
just
is an act.
and it's an act. So just be really, open about.
This is where the stand-up comedian comes in. No. So, yes, the answer is no, but I will explain. So, I will explain a little bit about the Trans Protection Right Act 2018. We worked so hard for it, and it took us almost 7 years. We started this journey in 2011 when Almas Bobby, a very huge name from Pakistan, old school activists, senior activists, she started protest against the rights and the violence and the harassment which was happening to the Hijra community, to the Khwaja Sara community. In Pakistan, we call it Khwaja Sara. So it happened since 2011, and then we all were boys before the transition. Not boys, I should say. We were acting as boys to get education. So we were getting our education in the universities, but we were seeing that something is happening, and we have to put our effort into it because we're getting the education. So all of our group, I belong to the first educated group of transgender people in Pakistan. We were 9 trans women and 2 trans men who collectively started working on the law. We did our research. We went to the ground, the root of the community and do the questionnaires, the research. What do you want? What is the actual need? What should we do? What should we write in the law? And then we contacted the lawyers, the allies, the good lawyers who were ready to support us. It was not easy. It was not easy. Even the discussion was very difficult. You start talking about the trans rights, and the T is from LGBTQI community. And, they were like, no, this will happen. And everything actually happened. The Shariat law, the Islamic law, they started opposing this since the beginning. But I think God was in our favor, yes, for the first time for Pakistan. And it happened. We were shocked. Even we were shocked. We filed the petition and we filed this act in the parliament, and we were like, at least something has happened. We know it's not to be passed. And it did. It happened, and we were like, wow, it happened. We celebrated it. Everything was there. The basic needs, the education, the employment, the healthcare services, self-identity. Self-identity was a huge step in Pakistan. Because anywhere in Pakistan you go and you tell that I'm a trans woman, they will tell you to take off your pants. We want to look. Even it's my personal experience. When I used to go to the hospitals before the law, the doctors, the moment they find out that I'm trans, they're like, are you sexually active? Because I had a sore throat, and he connected it with a STI. I was shocked. I said, which STI is this in my throat? Please, can you explain it? I'm confused. So the condition was so bad, and then the doctor actually told my father that we need to check her if she's a real intersex or not, a real Khwaja Sara. So we also use the intersex terminology in the law. The concept was intersex, but we use the word transgender. At that time, our educated politicians and the Shariat mullahs, they didn't know about transgender term, so they were considering it as intersex. So they were fine with it, because intersex had the word sex, and they were like, no, nothing, no sex. So transgender was fine with them. Sex was not. So it happened. The law was passed. We were so happy. And it's 2024. If you ask about the change after the law, I think 0.000009%, because the things are still same. I and all of my friends, we were, the law says it's on the paper, it's passed, everything is there. It says that we will not be discriminated in the public spaces. We will get the equal healthcare opportunities, equal employment opportunities, equal educational opportunities, and there will be no discrimination in that case. But what is happening actually, we are getting the law. They didn't define the protocols, or the mechanism to implement the law. The implementation is so weak, so weak. And now we are protesting for the implementation, and it's been 8 years, almost 8 years. The conditions are same. When we go for our CNIC, we tell them that we're trans, we have the self-identity X. They're like, which law says that? Show us the law. I still have the law in my phone, because whenever I have to discuss it in the police station for the violence cases, I handle violence cases in Punjab, Lahore, and all the cities and villages around. Whenever I go to the police station, I am telling them, no, actually, sir, we have a law. So these guys are culprits. Which law? Sorry, we don't get any intimation from the government. Can you show us the law? And then I have to show them the law. Literally, I have to show them the law. They're like, there is a law. Okay, we will see what kind of, because rape is still the vaginal. Yes.
Vaginal.
Yes. So trans people, we still have the 377 law. I don't even want to speak. So rape is very difficult to register this to the police and to the authorities, that this is rape. They're like, how can we, this is not rape as per our understanding. We will put violence and harassment. So there are no cases for rapes, because they cannot do it. Our law doesn't say that. So the implementation is so weak. We're still trying to, pressurize the government. We are trying to do the protests, talk about it more through social media, through the protests and the meetings and the conferences, that now is the time implement the law. Implementation is very other than otherwise we were standing at the same place before the law. It's just a paper which has been passed and it's there in our constitution. Other than that, it's not.